Joining us now are Athol Trollip, Patricia Kopane and Thoko Mashiane. Very good morning to you, ladies and gentlemen. Appreciate your time. If I could start off with you, Mr. Trollip. As a former mayor of the Nelson Mandela Bay Metropolitan Municipality, what lessons have you learned from your tenure, and how do you expect to use this as a candidate if you are indeed elected?
Thank you very much, Stephen. I really appreciate that question.
Hugo, actually.
My experience, Stephen, in Nelson Mandela Bay was that you can turn a city around, and that, we'd gone from the second worst metro to the second best in 1 year, and by the end of our second year in office, we had the same credit rating as the city of Cape Town. So my experience is that things can change, they can be fixed. Our slogan is ActionSA, is Let's Fix South Africa. And today I'm in Kariga, it used to be called Uitenhage, and I'm at the Allen Ridge Hall that was named after Reverend Allen Hendrikse, and the hall has been completely dismantled. It looks like a building in a war-torn country, and we're here today to start an initiative in the Eastern Cape to fix the Eastern Cape one town at a time, and I've got a business person who has come on board who's committed himself to fixing Kariga, and we will go to every town in this province to encourage business people, community leaders to stand up and take the responsibility to fix their towns. And if we can fix our towns, especially small rural platteland towns, I believe we can make this province work.
Now, just how much support is this individual going to give you, and what sort of changes do you expect to make from the support that you speak of?
Well, it's extraordinary. This guy joined us. He spoke to Mr. Mashaba 2 weeks ago, and then I met him the following week. He committed himself to joining ActionSA to help fix the Eastern Cape. He has already printed a whole lot of pamphlets, posters, purchased a lot of T-shirts. He says that he's going to make Kariga green and that he will pour all of his resources into doing that. And it's something that I've never experienced before, the kind of overture and commitment to put his hand in his pocket and to do something for his own town. I think he was inspired by meeting Herman Mashaba, who is one of the few leaders in South Africa that has continually got his hand in his own pocket, deep in his own pocket, to try and fix South Africa.
Presumably these amounts of support that your party is getting will be declared as is now required by the new laws.
I think we're the only party in South Africa that fully makes all of our declarations. I mean, there are new parties that have come on board that have raised hundreds of millions and they haven't even declared them. We declare every single cent that we make. And if other people don't respect the law, that's their problem. We respect the law in this country and we make the necessary declarations.
Mama Mashiane, if I could come to you now, given your experience as a former municipal manager and ANC Women's League leader, how do you plan to address the breakdown in the rule of law and the unreliable service delivery in Mpumalanga?
Thank you so much. My experience as a municipal manager, I learned to understand the rural problems that more especially women in those rural areas are suffering from. And the service delivery, the reason why service delivery is so poor, it's because there are people sitting in offices deciding on what to do on those areas instead of going to the people. Let me tell you a story. When I was still a municipal manager, I went to one rural area for an IDP, and in that area, the councillors were all males, and their first priority was roads. When their women are walking with buckets full of water for a kilometer, 1.2 kilometers to fetch water. So for them, the priority was not water, but it was road. So you need to go to the people. You need to, there's no one size fits all. So what I'm going to do is to go to those areas, know what they need so that when you deliver those things, they are being appreciated by those communities.
I'd imagine one of the challenges that you'll face is bridging the gap between your previous affiliation with the ANC and your current role as an ActionSA Premier candidate. And how will you ensure that your leadership remains independent and focused on the interests of the people that you seek to represent?
Fortunately, my leaving the ANC had nothing to do with the people of Mpumalanga. It was my own decision. So for me, it's not about leaving the ANC, joining ActionSA, but is to fix Mpumalanga and to help the people of Mpumalanga to get the best service delivery they can get, to be recognized. Because as I said yesterday, we are at 36.1% unemployment in this province. When we have so much natural resources, so much industries, Some of them have been closed. So it won't affect me at all.
Well, we must talk about the grappling with issues of corruption and mismanagement at various levels of government. And it seems to be one of those issues that's a thorn in the flesh, highly impacts service delivery. Is it something that is high on your agenda?
Yes, as ActionSA, we're committed not to follow the cadre deployment, but to appoint people according to their qualifications. Because that's the problem. You can't employ a nurse to be an engineer. That's not possible.
Now, one of the things that we've realized in the last few months, in fact, the last few years, is that there's this massive disconnect between the people in the communities and those that represent them in Parliament or at council levels, a massive disconnect. How do you intend to ensure that you have the people's needs at heart, continual engagement?
You know, what I like about ActionSA, those people who are going to Parliament and to the legislatures were not voted in by the raising of hands in a hall somewhere. They went through vigorous testing, interviews, and they know exactly that when they are there in those legislatures, they're not there for themselves. They're going to represent the people. And there will be a mechanism to monitor that they go back to the people. What they say in those legislatures and the Parliament, it's what has been gathered from those meetings with the people, and they're taking it forward, not their own thoughts.
So let's talk about building effective governance structures, and this requires collaboration and obviously cooperation across party lines. How do you plan to navigate political differences and building consensus among diverse stakeholders? Because one of the things that's almost certain is that there isn't going to be a single political party that takes all the seats. There's obviously going to have to be a lot of collaboration.
I think my experience as a municipal manager, I remember I was in the PEC, PWC of the ANC, and at the same time I was the municipal manager. I had to manage different political parties in that council. And I'm telling you, I never had any issue with any political party saying that I'm being biased towards the ANC. So that is a piece of cake for me to work with other political parties. I've been there. I've just earned my stripes.
Madam Kopane, thank you so much for joining us. Now, we understand that you have your background as a nurse. How do you intend to tackle systemic issues in the healthcare system of the Free State to start off with?
Good morning, and thank you so much for the opportunity. Definitely, our healthcare system have collapsed in the Free State. And as ActionSA, as you remember, we had our policy conference where we consulted with individual South African people and with the experts and people who are in the healthcare system. So it is obvious for us to fix our healthcare system, we need to have competent people who will run our hospital. And the problem in South Africa with regarding to healthcare system, it's not because there is no money. There is money, but we have officials that are not competent to do the job. Cadre deployment is one of the issues that we need to get rid of it. We need to go back to the basic where hospitals will run by people with a medical background who understand what is happening. And one of the most important things in a hospital, the hospital infrastructure, it is a very important key thing. Even the resources, it is so sad even today. There are still old women who still have to queue from 4 o'clock in the morning for them to queue to get the medication from the clinic. And when they're supposed to be assisted, there is no nurses, there is no medication. So as ActionSA, we are going to make sure that we prioritize the primary health care. We make sure that there are nurses, there are doctors. And something that is also key, that is so important, we need to make sure that our health care is governed by professionals. And we will make sure that now we're having a load shedding, of which is one of the backlog in all the hospitals. Patients are dying because of the hospitals not having the resources. Doctors are resigning, leaving the country. Nurses are leaving. NHI, you can also see it's something that is not going to work. and we are not even supporting it. So as ActionSA, we'll definitely make sure that we go back to the basic. Open the nursing colleges so that we have more nurses that are going to look after our patients. Make sure that the medical schools, they are open. We have enough doctors so that they can work even in rural areas and people get attention. Those are the most important things that we need to do. Something that is also critical, we need to make sure that the Office of Standard and Compliance, that office, we need to make sure that the ombudsman, when we get into power as ActionSA, will definitely lobby that office of ombudsman. It must be appointed not by the Minister of Health, but it must be appointed by Parliament. It must be funded by Parliament. It must have investigation powers, and it must be able to adjudicate on each and every matter to make sure that both public and private hospitals, they really comply with the norms and standards to make sure that those things are happening. Something that is also important, Health Professional Council of South Africa must definitely have a system in place to make sure that when the doctors are paying their annual, because you remember Health Professional Council of South Africa is responsible for the conduct of doctors. It is responsible also to make sure that when they pay their annual fees as members, we must have a system to track that these people, they are still in South Africa. Because currently Health Professional Council of South Africa, they don't have a system in place. How many doctors are in the country? Same with the South African Nursing Council. South African Nursing Council, they are also responsible for the conduct of nurses. They are also responsible for to make sure that the curriculum, it covers everything. But they must also have a system in place to trace that nurses who are registered, are they in the country? Currently, we have numbers in terms of the papers, both doctors and nurses, but they are not in the country. So as ActionSA will make sure that all these two bodies, they are fully operational. That's what we are going to do. And we want to make sure that the healthcare system is accessible. The clinics must be open 24 hours. That's what is important. And now we're having a load shedding in our country. As ActionSA, we advocate that for hospitals to be efficient and productive, there must be excluded. That's why we approached the High Court to say that hospitals and the other essential services, they must not be part of load shedding. And as ActionSA, we do believe that one thing that is important, electricity is supposed to be one of the human rights issues, because you cannot operate a patient when there's no electricity. There is no water. All the health facilities, they must definitely have the generators. Renewable energy is something that is also important. And I will make sure that each and every healthcare system, they must have insourcing. There must be a plumber when the tap is broken. We shouldn't put a tender while the water is running everywhere. So those are the things that we are going to make sure that they are in place, and the patients, they become the key people. And I will make sure that this thing of having tenders in the hospital for the cleaners, it's just not something that we're going to do. People must be employed, and we'll make sure that we curb corruption. And we'll make sure that whenever there is a tender, it must be advertised openly. So we need to know who are the people who are doing the tender.
I'm afraid we've run short of time, but I have to thank you, Madam Patricia Kopane and Madam Thoko Mashiane from the ActionSA for those insights. You're watching